Hello again. I'm sitting here with Gene Ransom, the Chief Executive Officer of MedChi. Gene's got a long, impressive list of accomplishments, too long for me to want to make an introduction out of. So I'm going to ask Gene to introduce himself and tell us something about MedChi.
Thanks, Ted. I really am excited to be here with you today. MedChi, which is the Maryland State Medical Society, is really pleased and feels that ARP is an important partner. We work with ARP on issues like end-of-life education, other issues that are important to seniors, and I'm really glad to be here with you. So to answer your question, I am the CEO of the Maryland State Medical Society. MedChi is the physician association in Maryland. I have worked with them now for the last 26 years. I started as a young lawyer out of law school, working in the general counsel's office there. And about 15 years ago or so, they made me the CEO. I also was an elected official as a county commissioner for a short time, and I am a lifelong resident of the Eastern Shore and still live there today, even though I do go to Baltimore quite regularly for where our main office is. We have an office in Baltimore and one in Annapolis.
What does MedChi do?
So MedChi is the professional association for physicians. We represent Maryland physicians. We are physicians advocate. We're their resource. We do things to really improve physicians' quality of life. Our mission is to be the foremost advocate for physicians, patients, and the public health of Maryland. We were formed in 1799. We're the 7th oldest medical society in the United States. We're the official component of the American Medical Association. And pretty much from soup to nuts, if a doctor has a need, we do it. Some of the major core projects we're working on are the Center for Value-Based Care, the Center for a Healthy Maryland, which works on a lot of public health projects, the Center for Private Practice, which helps doctors who are still in private practice. And we also are one of the largest providers of continuing medical education in the state of Maryland, if not the largest.
Continuing ed, how does that work?
So physicians are required in Maryland to take 50 credits for their license every 2 years of continuing education, but they also have requirements based on their specialty as well. So we actually have 2 CME programs, one that creates and develops continuing education for physicians generally on issues ranging from clinical topics to opioids to prescription drug monitoring to dispensing. There's a whole range of things that we do CME on. But then the other thing we do is we accredit other entities like hospitals to provide continuing education. So that's one of the things we do as part of our one of our missions is to continue to make sure that physicians are currently and constantly staying up to speed, because we want to make sure that obviously docs know the newest and latest information so they can make good decisions.
Things change rather rapidly in this world today, don't they?
They do. It's very interesting. I'm a lawyer by training, Ted. I went to law school. Actually, I went to undergrad at the University of Maryland, and I went to law school at the University of Baltimore. In Maryland, interestingly, lawyers are not required to take continuing education. Now, I do it because I think it's important, and particularly I focus a lot on health law with mine, but unlike doctors, there's no requirement. But I think you're absolutely right about that. It's really important for everybody to just keep learning. I think it's fun, and also it keeps you relevant and sharp.
Well, that sounds very interesting. Are all doctors members?
So no, physicians are members if they would like to be members. And actually, we also run multiple services. So we have an interesting dynamic where we have about 9,000 doctors who are members. Then we have about 12,000 doctors who receive some kind of services from us. You know, maybe they're part of one of our value-based care programs, or maybe they're buying insurance from the insurance agency we have, or maybe they go to our rehab center. But we have a whole lot of services. So between everything we're representing, we believe our reach is about 12 to 13,000 physicians in Maryland. And in Maryland, there's probably about 18,000 physicians who are practicing. So we have a pretty substantial reach among those physicians. And when we do polling or talk to physicians, we find that a lot of them know who MedChi is, even if they're not maybe actively involved, and they are interested in the stuff we're working on. Because a lot of the work, and I think the interactions you and I have had in the past, have been around Annapolis and legislation. And obviously, we've spent a lot of time advocating for physicians in Annapolis.
Seems to me, if I did the mental gymnastics quickly, you have something like 65% of all physicians in Maryland are members of MedChi.
It really depends on how you count, but of the active practicing, that's probably a fair guesstimate, or we're touching that many in one way or another.
That's a fascinating number. Can anybody join MedChi? Can I join MedChi?
No, just physicians. You have to be a physician.
Just
You have to be an MD or a DO. And when we were prepping for this, you mentioned the word doctor, but doctors can be non-physicians sometimes, right? So you really have to be a physician.
You have to be a physician.
Yeah, you call all physicians doctors, but not all doctors are physicians.
Well,
and actually, that's an important point for your members, bringing that up, because, it's really important for you to know who's treating you, right? You should really ask, are you a physician? Are you a physician assistant? Are you a nurse practitioner? Are you a podiatrist? Not that there's anything wrong with any of those other specialties or those groups, but you want to know who's giving you the advice. And it's a really important thing to know as a consumer that there is a difference between an ophthalmologist and an optometrist. And a lot of people don't know that.
Yes, I know that's true. And I also can agree with you that there's a whole list of designations today where people are giving you advice or even prescriptions, and they're not all physicians. So what you just said, I take to heart. That's a great thing to remember. So how do you help seniors in particular?
Well, I think seniors, obviously, we really do. And if you listen to our mission as the foremost advocate for physicians, patients, and the public health, the two parts of our mission that really obviously affect all seniors are patients and the public health, because seniors are all patients, and seniors obviously care about the public health. So first of all, one of the things that we're really involved in is a lot of value-based care type programs around Medicare. We have been very strong supporters, and a lot of our members are involved in something called the Maryland Primary Care Program, which is a really exciting Medicare demonstration model in the state of Maryland that provides a higher level of service to Medicare patients who happen to be going to a physician who's in the Maryland Primary Care Program. And that means that those patients might get additional care management, additional services, and additional help. And that's included in what they receive anyway. So we work on programs like that are kind of interesting and really directly affect seniors. Secondly, we work on policy issues that are really important to seniors. This session, we supported legislation that would expand access to people, which can be huge for people who fit into gaps and things like that. We have supported several organizations around the drug pricing legislation. We think it's really important that drug prices get under control. My physicians will often come to me and talk to me about patients who are making decisions about whether to fill scripts or whether to pay their rent or to pay for other bills or to pay for food even. So getting those drug prices down is something that we're very focused on and something that's a high priority for MedChi. And I think the other thing that we do is we really try to make sure patients through our physicians make really good choices when it comes to insurance. And one of the things that I've seen in my time at MedChi in the 26 or 27 years I've been there is it can be very hard for patients to select the right insurance company during open enrollment. And that's something we do educational flyers on and give them out to patients. We do press releases, we do articles. We really want people to ask those right questions when that open enrollment period happens.
Can individuals call MedChi for that kind of advice?
So you can always call MedChi. And if anybody wants to call MedChi, you can do that at 410-539-0872. You can always go to our website, which is www.medchi.org, and we have an ability to email us through the website. And that might be easier and get it to the right place quicker than bouncing around through the different employees. And we certainly take calls from anybody and try to help them. Obviously, we're a member organization and we're a physician organization, so our top priority is taking care of our physicians. But again, we help patients all the time. We also are unified with our county medical societies. So if you want to reach out to the county medical societies, oftentimes in the bigger counties like Montgomery County or Anne Arundel or Baltimore City or Prince George's, they will help you. They can help you find a physician if you're having trouble finding a doc. They can help you with other things like that. So we're always willing to try to be helpful, and we try to respond to every call that we get, even if it's not 100% in our bailiwick.
Well, how about complaints? If I had a complaint about a physician, would I call MedChi?
You can, but really the better place if you have a complaint is to file a complaint with the Board of Physicians. The Board of Physicians is the state agency that licenses and disciplines physicians. And if you had a problem, so let me suggest this. If you're having a problem with a physician, the first thing you should do is complain to the physician. I think that's the most important thing. And it's the step that a lot of us don't take, right? You know, you think about it when you get home, you weren't happy with the interaction, you didn't feel like you got what you needed, things weren't going well. Well, picking up the phone and calling them and complaining to them is the first thing you should do, and give that doctor, that physician, an opportunity to resolve it, because maybe it was a lower level person or a mid-level person who made a mistake in the office, or maybe there was another problem, or maybe the doctor was simply having a bad day, and giving that physician, giving him a chance to fix it, I think is a good place to start. And if that doesn't work, then what I would suggest is the Board of Physicians is the place where complaints should go about standard of care or other bad acts. And you can file a complaint very easily to the Board of Physicians by simply going online.
That I never knew that. That's very interesting.
Yeah, but again, I really would urge, I think too, and I've seen this, I have a couple older family members that I've helped out, and a lot of times they're unhappy, but they don't feel comfortable, saying something. I just want to really encourage people to communicate to the doctor. The physician doesn't want you to have a bad experience, and they're under a lot of pressure, right? They've got pressure to see a certain number of patients, sometimes from their employer or from the hospital. They've got pressures from the insurance companies. They've got, maybe they're having a fight over getting something prior authorized or having to deal with something else. So they might have just been off a little bit or been dealing with something, or maybe they didn't fully appreciate what you were trying to ask them or the outcome. So it's really worth having the conversation with them. And I think by doing that, they can address whatever the concern is 9 out of 10 times. That's not to say there aren't people who don't do things right or mess things up, and those people need to have complaints filed against them so they can be dealt with. With the number of people who are licensed, you're going to have a few bad apples, and they need to be punished and dealt with appropriately.
What kind of plans, if any, does MedChi have for future accessibility of medical care?
So on access to care, that's a key tenet, and that's something we've worked on the entire time I've been with the society, since the 90s. We right now are supporting the Healthcare for All package, which includes expanding easy enrollment, expanding access to the exchange to people who are not 100% documented correctly, and other items that would get everybody to have access to healthcare. We think it's important that everybody has access to health insurance. We're very blessed in the state of Maryland because we have a unique hospital rate setting system, which means we do have access to a higher level of care on the hospital side. But again, most treatment is done outside the hospital, and it should be. So it's really important that people have access to insurance so they get access to healthcare. One of the issues that I think we're really concerned about, and we're beginning to put a lot of energy and work into, is we're beginning to have workforce shortages, and that is causing us to have access problems. So what's happened is for a lot of reasons, Maryland's a very low paid state. So a lot of doctors move to other states where they can make more money. A lot of physicians or healthcare workers do that. The general tension that is across the entire marketplace, just across the country with everything, with people retiring and the burnout from COVID, there's really been a reduction in the number of healthcare workers generally. And that's meant it's a lot harder to get into a doctor office. And one of the things we're trying to do is figure out, can we increase loan repayment? Can we take other actions or do other things to bring more healthcare workers, not just physicians, frankly, all healthcare workers in, to try to increase that supply so people can get in and see the doc? Because oftentimes the barrier is not having insurance. The barrier is not having a physician to go to.
I've experienced long waits just to see a doctor. It's so I can understand that, and it's very frustrating.
And it's gotten worse. It's gotten worse in the last few years. The number of docs that have resigned or retired and just said, I need a break, or I think the stress of COVID really affected healthcare acutely. And I think a lot of those people just said, I need to do something else. I need to take a break, or they said, I'm able to retire and I'm going to do it. So it just seems to me that that's really hurting our system, combined with the fact that we are not, Maryland, for various reasons, is not a high physician pay state. So we're in competition with the other 49 states. And if you can move to Texas or even Virginia and make significantly more money, it is a factor. And when you put all those things together, it makes it very hard to find physicians, particularly in certain parts of the state.
You've given me a lot to talk about and think about. My gracious.
Sorry.
Is there anything you would want to say to wind this down that you'd want people to know?
Well, I think the one thing that I'm proudest of that we've done is we've been really active in expanding access to healthcare. We were involved in the Medicaid expansion. We've been fighting hard to make sure Medicaid payment is high so people take that. I also think that the other thing, particularly for the ARP members, is when open enrollment comes around, and there's really two times when your members would need to think about this. The one is when they are turning the age where they need to go into Medicare, or they decide to go into Medicare. There's a time period where they're going to make selections. And then the other time is in the fall, typically in that October, November period, there's an open enrollment period where you can make changes. And I just think it's really important for them to make choices around the plans that make sense for them. And for some people, Medicare Direct is the best way to go. For some people, they might want a Medicare Advantage plan. But if they are picking a particular company, particularly, it is really important that they make sure that they think about, are the drugs that I'm taking covered? Do they have rules like step therapy or prior auth that are going to make it difficult for me to get certain procedures or drugs covered? Are my physicians that I'm currently going to that I like covered? Are they in the network? If they're not in the network, is that going to mean I'm going to pay more money? So I think that's a really important thing for your members to know. And I think it's something that when it's time to do that, don't wait until the last day of open enrollment to make your decision. Think about it ahead of time. Do some research. Look on our website. We'll have some tips. Go to other trusted sources like ARP and get some help. And I think that's something I really think your members should know. I'm proud to work for the 7th oldest medical society in the United States. We're going to be celebrating our 225th anniversary next year. And I'm really exciting. I'm hoping that we're going to be around for another 225 years after that. And I really think it's fun working for physicians. And again, I just want to reiterate where I started, which was our partnership with ARP is one of our important partnerships, and we love you guys. You're doing great work for your members in Annapolis, but frankly, all over the state. And we really appreciate working with you, and we really appreciate our partnership.
I just have to ask one question. Are you going to be around for the other 225 years?
I hope so. I'm an optimist at heart. I mean,
you go.
You gotta have high goals, right?
Right. That's very high.
You miss every basket you don't shoot, right? So, I might not make it for another 225, but we'll see what we can't do. All right.
There you go. Thank you so much for this interview. It's been very informative.
All right. Well, thanks for having me, Ted. It was really good seeing you.
Bye-bye.
Bye.
Okay.